And presenting this presentation today is Zoe Arana. She is a prevention consultant with us at Union Hub. I'm going to tell you guys a little bit more about Zoe. Zoe has her associates in Christian education, and she also has her degree in early education, a BA in communications, and she has an immense background in community service, focusing specifically on the Latin and immigrant communities. She is also working on her master's in organizational leadership. Zoe has a passion for authentic communication and making very meaningful connections with the people that she meets. She is a ray of sunshine in our office, and she leaves people with her favorite quote from Nelson Mandela. And I quote, "What counts in life is not the mere fact that we have lived, it is what difference we have made to the life of others." So without further ado, I will hand it over to Zoe. And Zoe, I will ask you to share your screen.
Good.
All right. Let's press from the beginning on your PowerPoint. We'll be all set.
Thank you so much, Safa. That was great, especially the sunshine part. I really appreciate that. And it is a pleasure for me to do this presentation on Women's Month. This is my favorite month, and the topic might not be my favorite, but talking about women's health is, and I'm very excited to discuss it with all of you, and thank all of you for being part of it. I just like to start by asking, does anybody know what PMDD is? Or is this the first time you heard of it? I'd like to know if you can put in the chat, is this the first time you heard that PMDD term? Or like you know somebody that's being treated for it? Or is it something that you're familiar with? Can you please put that in the chat? I would really appreciate that. No? Just want to know if you ever heard the term PMDD before. Very familiar. Good. Not familiar. And I asked this because apparently many women, millions of women suffer in silence, and this term is relatively new, like around 10 to 15 years. So it is very important for us to speak about it so we can help ourselves or anybody in our surroundings and our community. Okay, so let's dig in. We're gonna learn in this presentation, God willing, right? What is really PMDD, right? What are the symptoms and what do women suffer through? And what are some of the treatments the doctors are having now? And some coping routines that we as women could do, or people who menstruate, right? And it's this topic, right? Although it's like it seems for us to be so easily to talk about, is sometimes in some cultures a taboo subject. So I'm very excited to hear your opinions, women that are in this webinar, and I like to discuss it, like have more of a discussion of how important it is to discuss topics like PMDD. And so, what is it? PMDD stands for if I go back, PMDD stands for Premenstrual Cycle Disorder. And although some people know what PMS is, PMS and MDD are not the same, right? While both PMS and PMDD involve physical, emotional symptoms related to the menstrual cycle, PMDD is more severe and characterized specifically by extreme mood disturbances. So, we women, right, we go through this every month, right? And in America, in the US, 9 out of 10 women experience discomfort when menstruating as part of life. Like we experience that, almost every woman does, right? 9 out of 10. But 1 out of 3 experience PMS symptoms, and we're gonna see the difference. And 1 in 12 women experience or are officially diagnosed with PMDD. And we're going to learn that in order to diagnose it, it requires a whole process because it's so relatively new, right? And we're going to see in this video, right, what are the difference between PMS and PMDD. And I wanted to see the difference because PMS sometimes is even a joke. People joke about it. But are some symptoms that are so severe that women suffer a lot. So God willing, this video will work. And we'll hear it.
Friend Aunt Flo, our popular euphemism for menstruation. In this video, we will discuss her daughter, premenstrual. Pre comes to visit during the luteal phase before Aunt Flo, and she can cause significant disruption. The objectives of this video are to identify the criteria for making the diagnosis of PMS and PMDD and to describe treatment options for PMS and PMDD. Premenstrual comes to visit many women before Aunt Flo. Premenstrual symptoms occur in approximately 75 to 85% of women. It causes significant disruption in approximately 5 to 10% of women. We'll start with premenstrual syndrome, or PMS. PMS is a group of physical, mood-related, and behavioral changes that occur in a regular cyclic relationship to the luteal phase of the menstrual cycle and that interfere with some aspect of the patient's life. PMS can be diagnosed if a patient reports at least one of the following symptoms during the 5 days before menses of 3 menstrual cycles: depression, angry outbursts, irritability, anxiety, confusion, social withdrawal, breast tenderness, abdominal bloating, headache, or swelling of extremities. The diagnostic criteria for premenstrual dysphoric disorder, or PMDD, is outlined in the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. This DSM-4 states that PMDD can be diagnosed if there are a specific set of at least 5 of 11 possible symptoms with at least one core symptom of depressed mood, anxiety or tension, irritability, or decreased interest in activities or anhedonia. Other possible symptoms include a subjective sense of having difficulty concentrating, lethargy, fatigue, or a marked lack of energy, a marked change in appetite and cravings for certain foods, hypersomnia or insomnia, feeling overwhelmed or out of control, or somatic symptoms such as abdominal bloating, fatigue, and breast tenderness. These disturbances markedly interfere with work, school, or with usual social activities and relationships with others. Moving now to diagnosis. The majority of patients who present for treatment of PMS do not actually demonstrate symptoms related to the luteal phase. The differential diagnosis should include medical problems and psychiatric disorders. A menstrual diary involves a patient monitoring her symptoms for 2 or more consecutive menstrual cycles. For the diagnosis of PMS, she only needs one symptom and a symptom-free interval after her menses. For the diagnosis of PMDD, she needs 5 of the listed 11 symptoms with one core symptom, and she must have a symptom-free follicular phase. Let's conclude by...
So we're going to talk about treatments in the next slide, but when you see the different symptoms, right, you can understand that nobody can really be a productive part of the society suffering the symptoms, right? And although they give us a whole list, it's a bigger list, and even it's a bigger list than the one I'm giving you right now. And I always wonder, how can somebody function like while going to school, like raising kids sometimes, or having a job with having all these symptoms? And this usually happens 2 weeks or 1 week before the period comes. That's why they talk about that phase. And it's all of that, but the gastrointestinal issues, including constipation, diarrhea, nausea, or vomiting, that is constantly, so there's constantly sickness. So it is a big problem for women that suffer with this, and acne and back pain and bloating and cramps and dizziness and headaches, heart palpitations, appetite changes, eating too much or eating too little, right? Joint or muscle pain, muscle spasms, painful periods, and reduced sex drive. These are serious symptoms. And the problem is that not many women speak of it because they all think, or some of them think, it's just a period. Women have been having periods since the beginning of creation. And so what is wrong with me? Are you a baby? Or like they talk to themselves and saying like, what's wrong with me? And they try to fake it, I guess. And this also causes, it's not as simple as taking a Midol or a painkiller. These are serious serious symptoms, and we should address them accordingly, right? And these are just the physical, because when we go to the emotional symptoms, the list is longer. And I like to read it because for me, this knowledge is so important. I never realized that. And it's irritability, nervousness, lack of control, agitation, anger, anxiety, difficulty in concentrating, depression, severe fatigue, anxiety, confusion, forgetfulness, poor self-image, paranoia, emotional sensitivity, crying spells, and moodiness, trouble sleeping. So this will make a woman turn into a monster right before the period comes. And it's not really a fault of her own, but this is how her body responds to something so simple as just having the period. Now, the problem with all these symptoms, the emotional symptoms, is that many women have been diagnosed wrongly because they didn't know, doctors or science didn't know about PMDD. Right? Because they were diagnosed with depression, anxiety, but in reality, what they have is PMDD, right? And so, first of all, women have to come to the understanding that there is a problem, that these severe symptoms are not just simply having the period, but there's an issue there. They can come to their doctors and speak of their emotional symptoms also. And there's ways to get to that diagnosis. Like, for example, doctors now, when a woman complains of severe symptoms of PMS, now they ask them to do a journal of symptoms. And this is only to prevent them being wrongly diagnosed with another mental illness. It's just, but now we know about it. Like, doctors now can ask, okay, can you please journal? And then they journal for 2 months, I think. And then doctors can now see that there's not just simply a mental illness, right? But could be a PMDD. And I know that this subject is not really fun, right? But if you want to have a comment or you have a question, you can interrupt me at any time while I do the presentation, and we can address it. And this video really struck me, so I would like for you guys to pay attention to it, and we're gonna have a little discussion afterwards. These are women of all ages in the UK that have suffered from PMDD, and you will see some, just let's look at it for now.
Many times I have not wanted to be alive.
I've probably got 2 weeks of this. Depression, anxiety, suicidal thoughts.
Feel like I want to die.
Hopeless and lost and
debilitating,
tiring.
This is every single month that this happens, and it's all to do with my periods.
I just can't cope. Feeling suicidal. Yeah. So yeah, this is something that PMDD can do, and generally this is for 1 to 2 weeks of every single month. Every single month of my life.
I'm Dr. Hannah Short, and I know what PMDD is like. I now run a clinic trying to help women who are going through it. PMDD is an extreme form of premenstrual syndrome, or PMS, but many people have not heard of it. However, it is estimated to affect around 1 in 20 women.
I had a full hysterectomy with both ovaries removed. I had to fight to have this operation because a girl at 38 years old, why would she want to have this operation and put herself in additional risks?
I do know that my treatment that turned off my ovaries and put me into a chemical menopause, and then my surgery which removed my reproductive organs, I do know that that surgery did 100% save my life.
At the moment, I am on HRT at the age of 27.
The condition is recognised by the World Health Organisation, but there's not enough awareness of how severe it can be or how we can treat it.
He basically told me it's just PMS and we don't know what causes PMS, so there's nothing I can really do. But eat more soy and take evening primrose oil. And I was just sitting there thinking, I was crying at the time as well, and I just thought, I've just told you that I was suicidal, and this is what you're telling me to do, eat more soy.
I've been given a lot of leaflets about PMS and having a bath and smelling some lavender, having some chocolate, cuddling a dog, I mean, standard. Those are all really nice activities, but they're not recognised or known treatments for suicidal ideation.
And I had to repeat myself 17 times to the crisis team explaining what my condition was. Now, someone who's just attempted to take their life had to explain 17 times what the condition is. Now, that is completely unacceptable.
For me, getting a diagnosis pretty much saved my life.
The relief in knowing that it's not
I
my
remember
fault.
the gynecologist saying, yeah, I know what PMDD is, and I just thought, oh my God.
But now I have my life back. I just want everybody out there who is suffering alone, please reach out. There's support available. There are treatments that work for many people. There are so many of us out here.
So like I said, this was done on UK, right? And many women suffer in silence for years. But now the term PMDD, which I don't know if I said it enough, is Premenstrual Dysphoric Disorder. It's now well known, or at least it's getting to be well known to help others. I wonder if you have an opinion of what the video, if you grasp what the video said there, you know, and if you have a comment or a comment about what these women had to say. We see there women from ages 17 to older ages, and the first lady that spoke at 38 had to go for this severe surgery without being a mother, and that's because she couldn't help dealing with the situation of PMDD. Do you guys have any comments?
You know, Zoe, as a clinician, I feel like this is not something that's spoken about enough, because even in those videos that you showed us, there was a lot of information that I wasn't aware of. And as clinicians, you know, making sure that you understand the differences across various diagnoses is incredibly important, and seeing how at like a community level of how this diagnosis can influence behaviors through how it interacts with the body has clearly been so unspoken about in places where it should be, based on suicidal ideation, and how that woman had to explain 17 times to a crisis manager what he was dealing with. It sounds like we're getting somewhere, but it sounds like it still needs to be spoken about in a large.
Thank you so much for your.
I had to explain.
I'm sorry, I'm having technical difficulties, but thank you so much for your comments. And I agree with you. When I learned about this, I thought there had to be more that we could do, because there's so many. And then you see the younger women, right? The ones that are like really new to all the symptoms, and they know less than what we know, right? Anybody else?
I put this in the chat, but I could just say it. Can you hear me?
Yeah.
My thing is weird. I was just gonna say it's such a shame how often medical doctors, don't take women's anecdotes or symptoms seriously. You hear it all the time where she's saying, I was having this pain, even for other things. And the doctor's like, well, it's fine. So I can imagine how difficult it is with PMDD, like trying to explain the feelings to a doctor and them just being like, yeah, you're just getting your period. That's just how it is. You know what I mean? I can't even imagine. I mean, I remember being like, you know, how old are you when you get your period? Like 12 11. Or whatever, even younger than that, 10, 11, 12. And my friends going through these things at like 10, 11, 12 years old. Like imagine that, or not even being aware of what how that can affect your mental health. Maybe thinking like, oh, maybe I am just suicidal. Maybe I do just hate my life. I just want to die. But it really is just your period and something that can, like, you can avoid, or not avoid, like, be treated.
Right. Thank you so much. And, also because to this day, they don't know what causes this. That there's not like, oh, this causes, we can prevent it this way. So the only thing they could do is treat it. And I'm going to try to go into the new slide, but I'm really hoping and praying I'm doing it right.
I think I saw Shayla have her hand up.
Okay, Shayla, sorry, go right ahead.
No, it's okay. I did, but then I was like, let me wait till the rest of the presentation. I didn't want to jump ahead, but to Ben's point, for clinicians and anybody working with somebody who gets a period, something I always go over with my clients is tracking their period and having an app because of their moods. And some of them have found it really helpful to see, okay, actually, X amount of days before I start having panic attacks, and then they noticed those symptoms. So they talked about that in the video. I just thought it was really great, and this is a really great topic that needs more awareness.
Yeah, I agree. Thank you so much, Shayla. I appreciate that, because we need to be our own advocates, right? We need to speak for women, and we need to also find more information. So this is great, being able to speak about it here. And then the treatments for PMDD, as I said before, they don't know what causes it. But they treat it with antidepressants. And like I mentioned, now doctors, gynecologists, they ask women to do like what Shayla said, like journal their symptoms and see exactly within a week or 2 weeks before the periods, and so they can be diagnosed correctly, right? So antidepressant and cognitive behavioral therapy, which is simply talk therapy, helps women also with this. So it's a whole range of treatments just for the mental parts, emotional parts of PMDD. Birth control pills has also been used for a long, long time to treat PMS, but now it helps them also with PMDD, but not a lot, because apparently it actually increases symptoms. So that's still in studies, but it helps them with the changes of hormones to deal with PMDD. It helps with PMS, but not much with PMDD. And hormone therapy, right? That's when they give an estrogen and some testosterone to help them deal and cope with that, which also has some side effects. And the worst, not really, I think the final treatment is hysterectomy, is when they remove all their reproductive organs. And that is, I don't feel really good about that. It's the last stage, is when they can't help it. That's when women are completely sort of suicide every month, and they go through severe symptoms every single month. Then the option is to just have their organs removed and bring them into chemical menopause. Some women are very young and they're never able to experience motherhood. So it is a serious, serious situation. I just don't like the fact that we're still there as a treatment, right? But that's how it is. And so natural remedies to cope with PMDD while we have the period, while it's happening, it's just normal, being able to enjoy a good sleep. Make sure, be intentional of having a good night's sleep, right? Have good hygiene, obviously. Aromatherapy, and I'm going to go into details later on, but the vitamin supplements and a good diet and herbal remedies like teas help while it's happening, while the week before the period is happening. But natural ways to treat it means when it's not happening, what you do the whole month, right? Not just the 2 weeks, but the whole month. And aromatherapy helps all the time if you have essential oils like rosehip oil and primor oil and lavender oil. And that is something that you can inhale. You can put it in and just breathe on it. It helps your mind calm down, and you can also massage your body with them. That's how aromatherapy can help. and vitamin supplements. This is something also being used by doctors, not just simply, word of mouth, but doctors are encouraging all B vitamins. Vitamin B2, B6, B12 help with all these symptoms. Vitamin A, D, folic acid, and magnesium. All of these are required, sometimes more when we don't have a good diet, right? Because these are nutrients our body needs to help us do the period, for help the body to develop something that is so normal for humans that are called women, that would be the vitamins. So what we need to do is be intentional about being very nutrient, like find these vitamins in our diets, and not just in supplements. And then warm bath. It's helpful while it's happening also, but it also helps like in the process of the period coming. And 104 Fahrenheit degrees. Warm bath or warm showers for 30 minutes is what the doctors are recommending, and it helps them, right? And mentally, my dear fellow women, we have to be mindful, present in the fact that we have to eat healthy. Again, they don't know what causes PMDD, right? And then the treatments are really severe and everything. But like having a healthy diet is vital. Like your plate needs to look very green, because green then it shows that it has magnesium, and magnesium is a mineral that they recommend to prevent PMDD. So that's very, very important. Stay positive, meaning do not get disappointed, discouraged, or feel like you're alone. You're not alone, right? We are all women, and although this term is new, we're learning to help one another. So stay positive, right? Get enough sleep, like I said before, and get physically active. This is very important. Very, very important. The same way the diet, the sleep is very important. Like if we cannot make it to the gym, or, we don't like the gym, like some people, then have a walk. Walk like at least 30 minutes a day, and that will help you. And finally, seek professional help. It is not longer considered embarrassing to tell your gynecologist, this is happening in my mental state when I'm having my period or before I'm having my period. Some people think doctors are just there for the physical, but you go over there and you let them know this is happening to me. Like, seek professional help is very, very important. You don't have to suffer in silence, anymore, because we understand it. We got it. We see there's a term, even science has had the term, so there's things that you could do to help yourself. And thank you so much for listening. If you listen to my voice and you heard this presentation and you feel like you have some symptoms that are similar to this, please do seek professional help, and wish you the best. Thank you so much. Safa.
Thank you, Zoe. So I'm going to stop this participant screen sharing. However, I'd like for us to kind of talk about the topic, because I definitely have something to say. Let's see. So I think it's really important for us to take this into consideration when we talk about the youth that we serve, because we don't know exactly where everyone is, in that cycle process. Some young women get it earlier, some get it later, and just, the first, couple of years of getting your menses can be an extremely overwhelming process. So, as that process develops, you never know when someone can develop PMDD. And just to think that a youth could possibly be experiencing these symptoms, that in itself is a really scary thought. Being an adult and experiencing is one thing, but being a young person experiencing those symptoms can be extremely just scary. And I don't want, I don't wish that on anyone. But with the work that we do, I think it's very vital that this presentation was delivered to have, that just extra level of sensitivity and education and awareness about this topic. I have included our feedback form. I'd like to thank everyone who was a part of this beautiful webinar. Thank you, Zoe, for presenting this wonderful information. It was very critical and a very special part of our women's series. If you would like to see more presentations of this nature, or not just pertaining to Women's Month, but general information and workshops of this nature, please do us a favor and check out our feedback form, rate the presentation, and please keep your eyes out on NJ4S Union Hub. We're doing wonderful things in the community. Follow our social media page at NJ4S Union on Instagram, and please check out our portal at nj4s.nj.gov, and please join us in other webinars to come. You can also send us an email at nj4sunion@preventionlinks.org. Thank you all again for joining, and I hope you have a